Hello and welcome to Happy Cells and Souls. My name is Julie Powers and I'm a licensed Zumba instructor and I'm an affiliate with the Juice Plus company. And my missions in life are to help people understand that life is better when they're dancing through it and to inspire healthy living around the world. But my expanded mission is to create better health at the cellular level and more joy at the cellular level, because we only get one body while we're here and we have to take care of it. And while we're here, we're supposed to be happy and joyful and spread light and love into this world and help other people and make a good impact, right? And so that's what these interviews are about. These videos are introducing you to the people that I've met along the way throughout my life, the ones who I believe are making an impact in this world and bringing more light and love and helping people. And so today I get to talk with my good friend, Julie Berghaus, who I have known since high school, which was a long time ago. And Julie is one of those people that has done like so much throughout your life to help people. And it's always been about serving, whether it's in your professional career as a pharmacist or all of the volunteer efforts and everything that you've done throughout your life. But today we're going to talk about you in your pharmacist capacity and how you got started in that and what has changed in your career since 33 years ago when you began this journey professionally. So first of all, if you could tell us just a little bit about yourself and where you grew up and why did you get interested in pharmacy?
Well, I grew up in Farmington, Missouri, close to you, of course, because we went to high school together. I always wanted to be in a healthcare career. And originally I thought I wanted to be a nurse, but my mother was very, very ill as I was growing up in my teenage years and further on. And after visiting her in the hospital a few times and finding myself laid out on the floor because I would pass out from syncope from just being nervous when I was in there visiting, I decided maybe nursing was not going to be.
It's probably a good choice then.
I loved math and science. And of course, with her being sick, we visited the pharmacy quite often. And I thought, well, that's a way I could be in the healthcare field and I wouldn't have to be so close to it. So that's the reason I went into pharmacy. And I started working in pharmacy when I was 15. In high school, my local pharmacy hired me as a technician and decided.
Now, where was that? Where did you get started at 15?
That was Medicate Pharmacy, downtown
yes.
Farmington, across from the dime store.
Yep.
In the town square. So I worked there all through high school and through college, and then continued to work there as a pharmacist after I graduated from college.
And where did you go to school for pharmacy?
Well, back then it was called St. Louis College of Pharmacy. They've since changed the name and it has a really, really long name with pharmacy at the last of it now, but it's College of Health Careers and Pharmacy. So
okay, all right, but it's in St. Louis.
It's in St. Louis, yeah,
right
next door to Barnes.
And I know that you were always really smart in math and science, and those are two of the subjects that I never really enjoyed. So I'm glad that there are people like you out there. I like words, and you like numbers and math and science, so that's good. So when you decided to become a pharmacist, everything was built around local pharmacies. I mean, there was really not this whole corporate structure of pharmacy then, and everything was about those one-on-one relationships and knowing the people that came in to get their prescriptions filled. I would love to know what your experience has been from those first days until now and how things have changed over the years. And personally, that I am like trying to help people not be on prescription drugs. And you also are very interested in people not being on prescription drugs. But of course, we have to have them. And if we're going to have them, I love that there are pharmacists like you to provide real service to us and to know us. So tell me about your experience.
Well, and that is all very, very correct, what you have said. And yes, when I first got into pharmacy, I worked at an independent pharmacy. There were two in town, and well, three, I guess. But everybody knew their customers. Everybody knew who it was walking in the door. And honestly, even though it's evolved over 33 years since I've been a pharmacist, I have always worked at an independent pharmacy, always, to continue to provide those services. Yes, you're right. It's migrated into these big box stores where nobody knows who you are. You have to wait in line forever or days, even if you want to get your prescriptions. And it's all about the metrics and the numbers with these chain pharmacies. And they own their own insurance companies. They are also owned by a PBM, which is a pharmacy benefit manager, which is supposed to help take care of cost and also provide the best care in health for the customers. And that isn't what happens. It's all about the money that goes into their pocket and how many prescriptions they can fill in a day or an hour with as little bit, as least help as they can have to get things done. And it's just, it's ridiculous. So it has definitely changed from when I started. I've lost my passion for pharmacy in general because of what it's been allowed to evolve into. But as far as my love for my customers and what we do for people, that is still our mission at my pharmacy, is taking care of people, providing the service that they need, and helping to find the best ways not only to keep them healthy, but what they can afford to use to keep them healthy, because so many drugs now are so expensive. People have to choose. Am I going to take my blood pressure medicine, take my diabetes medicine? Which one can I do without this month? Because I really need to put food on the table versus get my medicine. So
and I know that you
really
mentioned that. Yeah, you mentioned that right before I hit the record button, was that you literally had a customer today or yesterday that was trying to decide between multiple medications, which one could she go without because it was going to cost too much. And that's really scary. And there are people that are on life-saving medications, and I know that, of course I could get into this whole thing about, well, let's try to get them healthier so they don't have to be on all those medications. But sometimes that's just too big of a leap for some people. And sometimes it's not possible where they are in life and with their medical situation, of course. So I know that you have also seen over the years, we've talked about this, that people are on more and more medications, and that children are on more and more medications. And I'm wondering about, what your take is on that. If that's something that is going to be controlled in some way, or is it just the thing that's happening with our country because of so many different aspects of what's happening? What do you think about that?
My personal opinion about that is, I think people have gotten more and more and more unhealthy as the years have gone by. And a lot of that is due to a variety of factors. But, our grandparents grew their own food. They put up their own food. It wasn't manufactured in a lab. It didn't have all the preservatives and all the additives and everything else that they dump into this stuff chemically. And maybe they didn't live as long as we did, but they sure lived healthier than what we do. And now it's just, people, it's so much easier to go through a drive-through or grab a package off the grocery store shelf and not even know what's in it, just because it's easy. And if you look at the obesity rate in children, that is leading to more and more healthcare issues. There are so many diabetic children now, and a lot of it is because of, some's genetic, but a lot of it is what we're putting in our mouth. We are what we eat, and nutrition plays a huge part of that. But the medical professionals are not taught nutrition first. They're taught these are the medicines you use to treat these issues, not what do you do to prevent these issues. And I think that's led to a lot of the problem that we have.
Yeah, I absolutely agree with that assessment. And I know that a lot of people today, from my conversations with many healthcare professionals, is that people come in looking for magic pills. They go to the doctor and expect a magic pill to fix their problem when it could have been prevented to begin with, or it could be something that decreases over a period of time by making some lifestyle choices. And instead, it's much easier to pay for the medication and take it that ends up having side effects. So that's another question that I have for you is, I know that a lot of pharmacists, that they really need to watch for those contraindications for, the medications that are working against each other or could cause problems.
Mhm.
So is there anything that you want to share with somebody who might be watching this about that, especially if they're getting prescriptions filled at multiple pharmacies? Because I know that's a thing, right? Like,
It is.
so, I mean, I know that some insurance plans, you have to get your things from a mail order prescription company in order to get the best price, or sometime to even get coverage at all. Fortunately, we have the option to do a mail order or our local pharmacy, which is you. And there are some things that, of course, there's just no way we could get them unless we got them through the mail order. But I like getting them from you. But there are other people that will use multiple pharmacies in order to kind of hide things from pharmacists and doctors and stuff. So I don't know if you want to talk about that at all and how dangerous that can be.
There's multiple reasons why people use various pharmacies, and some people do it because they may find it cheaper at Walmart versus at my store or Walgreens or whatever. I will say that it is a very dangerous practice because we cannot check drug interactions if there's stuff filled all over the place because we don't have access to that information. So it is always our suggestion to get things filled at one place, period. I mean, then you can watch for drug interactions, you can watch for duplicate therapies, you can have a better idea if, oh, they're coming in for a new prescription for something today, but they just started something new last week. Well, they're giving them this because they had a side effect from the previous prescription, but there's no way to know that if you're having them filled at multiple places. Now,
Right.
one suggestion I have, if you're doing that because you think it may be less expensive somewhere else, is please find an independent pharmacy, go to your independent pharmacist and just talk to them and say, I really would like to get this from you, but I can get it for this price somewhere else. What can you do to help me? Because all the time we're finding coupons for people, we find alternative medications that may be less expensive, and sometimes if people are paying out of pocket for it instead of using their insurance, we can offer them a much better price. Because I'll be honest, these insurance companies that are telling people they have to use their mail order pharmacy, again, they own their own pharmacies, they own the insurance company itself. So they pay themselves a lot better than they pay us. But a lot of times they'll come back saying, well, I have to charge such and such copay at my store, but you can get the same drug for a lesser copay at the chain that they own. But if you pay out of pocket for it, then sometimes we can do better with the price. So
Right. And that's
have
not
that
just that.
conversation. And
That's not
that's the
just at
reason.
your pharmacy, right? I mean, because somebody that's not in our area might be watching this, and they might have a local pharmacist down the street from them, or a friend that it works in a pharmacy, and they might be able to do the same thing depending on where you live. So this is not just Farmington, Missouri.
No, that's what I'm saying. Find an independent pharmacy. There's no way you can have those conversations with somebody that works for a chain. Chain pharmacies, the prices are set. There's no conversations.
Right.
It black and white. It is what it is. There's nothing that can be done with that. But if you go to an independent pharmacist, which there's fewer and fewer these days because we can't afford to keep our doors open with the way things are going. But we all are trying to do better for our communities, and that's why I mean, my daughter lives in Hawaii and she tells her friends, go to an independent pharmacy and talk to them. I'm telling you, my mom does this. So do
Right.
that. So yeah,
Right.
doesn't matter where you are.
Exactly, exactly. So whenever people are taking things other than prescription medications, is that something that they can talk to their pharmacist about? Like if they're taking herbal supplements or they're using essential oils or anything like that, is that something that they should bring up with you as well? Or, what's your take on that?
Essential oils are not such a big deal as far as interactions with prescription medication, but any over-the-counter medication and herbal supplements, there are some that do have significant interactions with prescription medication. So yes, anytime you're talking about what you take, if you're talking to your doctor and they're getting a list of your medications, or you're talking to your pharmacist, we need to know those things because they do have an effect on prescription medications sometimes. And sometimes,
Right.
it's people come in all the time asking for recommendations. So,
Well, I know that, like, for instance, you and I both are big believers in our whole food supplements that are not, I mean, they're not supplements, it's whole food. And so
right.
it's just food. It doesn't interact. It doesn't have a contraindication with any medication because it's like you're putting a salad into a capsule. But these other supplements, if somebody's taking like a niacin supplement and it's over the counter somewhere, then that can cause all kinds of funky things with other medications. Or if somebody decides to take, what is it, St. John's wort.
That's what I was going to say. It's
Yeah, I mean,
those types of things are
they cause major issues, right? With
yeah,
certain medications. It
exactly.
can have some pretty extreme side effects for people, but they don't think about it being, this is something I need to tell my doctor or my pharmacist because it's natural, it's herbal, it's, whatever. But you turn that thing around and if it says supplement facts on it, there's something about it that you need to know and you need to share with somebody.
And that's exactly right. And it's not just those things, it's anything over the counter. I mean, people have to be really weary of ibuprofen if they're on blood thinners or things like
Mhm.
that. And sometimes, you have a headache, you go grab something and you don't even think about it, but you really should be asking if you're on prescription medication before you take something.
Right. And even people who are on like an aspirin regiment or something that
Exactly.
that can also play a big role in other
What you
prescriptions.
take for pain. Uh-huh.
Mhm. Yep.
Exactly.
Glad I don't take a whole lot of medications. I try to avoid them at all costs.
Yeah, I
But,
know.
sometimes I have to have them, and that's
I
why I
know.
call Parkland Health Mart. And so is there anything that you have found that you would just, like you have this moment, and I don't know if one person is going to see this, Julie, or if 10 people or 100 people will see it, but whoever you can talk to right now that might see this, is there any one really important piece of information that you would like to share, either about choosing a pharmacy or having prescriptions filled, or that relationship with the pharmacist and the staff? Because I know that you've been an actual owner of Parkland Health Mart here in Farmington for how many years? You just had an anniversary.
5. We've been open for 5 years
Five
here.
years, yes. And you did that right before COVID.
Yeah,
Then it's
we
like,
did.
everything changed.
We did.
Um, so is there any bit of information that you'd like to share in the last couple of minutes here?
Well, our staff is just as important a part of our business as anything because we all have the same goal, and that is to help people. And I think that that is the goal company wide, but specifically here, we want to just make sure everyone stays healthy and everyone gets whatever it is they need. And I had someone make a comment to me a couple of weeks ago that I spoil my customers and I shouldn't be doing that. But that's what we do. I feel like we were put on this earth to take care of each other, and that is the philosophy that I have always tried to strive to have anywhere that I worked, but especially now that I own my own store. So if you need something, then just ask us. And we don't know what we don't know. So you have to have the conversation with us so that we know what it is that you need, so we can try to help you have a better life. I mean, life's too short, and you've got to take care of not just the medicine things, but the you just have to take care of all parts of you, not, you have to eat right, you have to decrease your stress, you have just your whole body. And there's some people that we deliver to, they only have a connection with my delivery driver. But
Yeah.
that's what we're here for. We're here to make those connections and not just provide you a product, but to try to take care of you, to make your life better. That's what we're here for.
That is great because, relationships aren't just something, they're everything. And if you can't have a relationship with the person who's actually providing these things to you, then you need to kind of think twice about it. Because if you're just a number, then what do you really mean to that person or that entity? And I think we need to get back to that. We need to get back to that, to the one-on-one, face-to-face. I know you, you know me, help take care of me, and I'll help take care of you. So yes.
Agreed.
Thank you so much for sharing a little bit of your story. And I wish we had more time, but
Me too.
it's always nice to see your face.
Well, thank you.
I will include below in the text the information on how to contact Julie if you're wanting to reach out to her and ask her any questions or find out more about the pharmacy. And thanks so much, Julie.
Thanks for having me.